David, you're very supportive of mindfulness and often recommend it to your clients, your patients. But when would you recommend it, and how would you explain mindfulness to the clients when you do recommend it?
Yeah, it's a good question. So in terms of when I recommend mindfulness, it's generally in conditions or sleep disorders where I think part of the core problem is the brain's too active during sleep. And people can get into that situation for a whole range of different reasons. Sometimes it's through being overly busy. Sometimes we're exposed to external stresses and get a bit over anxious. And sometimes it's thinking styles. So a tendency to worry can increase our risk of getting into that sort of situation. So there's a few different sleep disorders where that can happen. The one most commonly where that happens is insomnia. So insomnia is often characterised by overthinking sleep. It's not how it starts, but that's how it finishes. Often people really get a lot of emotion about sleep and trying very hard to control sleep and really analysing and monitoring and what can I do to make this better. So the brain's not switched off during sleep at all. It's all about, have I gone to sleep yet? Have I slept enough? What's happening? Can I sleep some more? Can I sleep in? All that style of thinking. So training in techniques to disconnect from some of that thinking, or to be able to training techniques to be able to switch off, is really helpful in insomnia. One of the other conditions where I'll use mindfulness is in managing parasomnias. So parasomnias, sleepwalking, sleep talking. So one of the triggers for them can be stress, but it can also be just if the brain's in those higher adrenaline levels during sleep, because essentially then muscles are more active during sleep. So it means people are more likely to do things, act out dreams, move while they're asleep. So one of the techniques for reducing that is actually to reduce brain adrenaline levels during sleep. So mindfulness is a great technique for that. So training people in mindfulness so that they're able to, through the day, reduce that sort of adrenaline levels and adrenaline sort of drive. And then at night time, the brain works in a more switched off type of state, so they don't get the same muscle activity. And the third group where I'll use mindfulness is in people who are feeling more tired during the day. It seems a bit strange to use it if you can't sleep and use it if you're too sleepy. But often if people are too tired, they've got an absolutely genuine biological reason why they're tired. They may have a physical condition or a mental health condition or a sleep disorder. But over years or months of feeling tired, the tiredness itself just gets its own story and emotion. And that can add another layer to symptoms. So it's not just I'm tired, it's I'm tired and I'm sick of being tired, and what does this mean for me, and why do I feel like this, and what can I do to make it better? That style of thinking actually just gets the brain more active during sleep and makes sleep poorer quality and leads to the tiredness being worse. So if we can address that layer with mindfulness, we can actually make quite a difference to people who are already feeling fatigued.
Great. I mean, how would you explain mindfulness to someone they've never heard it before? And as a doctor, how would you put it in your words?
Sure. So in simple terms, I try to talk about it as being present-focused observation. So one way of thinking about it as adults, we're often thinking about the future or the past and thinking more about judgments about our experiences, which in turn lead to emotions about our experiences. And both those judgments and emotions feed right into the adrenaline system, that sympathetic nervous system. So if we're constantly in that thinking space that's all about judgment and emotion, what does this mean? How do I need to respond to this? Did I do that okay? What have I got to do tomorrow? We're just constantly engaging that sympathetic nervous system and just higher adrenaline levels and the brain not switching off. Whereas if we can think in a more present and just observation sort of mode, then we're disconnecting that fight-flight response and not pushing up the adrenaline levels. But it's a style of thinking doesn't come naturally to us, particularly as adults and particularly in modern Western societies. One analogy I'll sometimes use with patients is, if you think of preschool age children, they have that more observations thinking style. The example being, two boys in the sandpit and one bops the other in the nose, and one's sore, cries while the nose is sore, but as soon as his nose isn't sore anymore, they're back playing together.
Forget it and they let it go.
They let it go. And really their thinking is, my nose was sore, it's no longer sore. The observation is, okay, I'm not sore anymore, I'll get back to playing.
Time to move on.
Whereas adults, it's not the same. Bloke hits the other bloke in the nose at the pub. It's not about my nose isn't sore anymore. It's about what's that mean? What's that mean for our friendship? I'm angry about that. It's got that layer of judgment and emotion. So as adults, we're really in that thinking space. So I see mindfulness as retraining us to be able to recognise when we're in that judgment emotion style of thinking and just reframe, recalibrate, get back to that present focused observation. And do that periodically through the day to enable us to disengage that sympathetic nervous system and that adrenaline system and just lower adrenaline levels.
Yes. Yeah.
Another type of analogy that's sometimes used is to just become an observer of thoughts and things around us rather than a participant in things. So that, you're on the train platform and think of your thoughts as trains that pass by, but you don't catch them.
Yes.
And you don't go for the journey and you don't sort of participate in everything that
Almost
happens.
you have a choice about whether you catch it or not. You know if you are. Yeah.
So that's another analogy I'll sometimes use when trying to explain mindfulness. When I think of it at a biological level and think of what I'm trying to achieve with mindfulness, it is all about disconnecting the sympathetic nervous system. So if we're in that mode during the day of doing and in a headspace of thinking in a judgment and emotion style of way, we're engaging that sympathetic nervous system, the adrenaline system, the fight-flight response. And if we engage that constantly in the day, there's no way we're going to be able to switch it off at night. Whereas if we switch to that being mode, which we rarely do, to stop and be, I don't have to be doing anything, and focus our sort of thoughts on that present focused observation, it disconnects that sympathetic nervous system. And if we do that intermittently throughout the day and make a practice of doing that on a regular basis, it allows the brain to better switch off at night. It takes a while, so it's not the sort of thing you do it for a day, right, where's my results? You've got to be persistent.
Requires daily practice.
It does require daily practice. But that's really, when I think about the biology, that's really how I think it works, and the research would support that.
Yes. David, a number of people who sign up for a mindfulness course have often tried a number of different things to try to improve their sleep.
Sure.
And perhaps have not had much success. So they may be feeling somewhat sceptical about embarking on a mindfulness training course.
Sure.
Do you have any tips or advice for people in that situation?
Yeah, it's a really common thing that we see. So, when you and I are seeing clients in our normal day-to-day clinical practice, in our role as health professionals, we hear that all the time. I've tried everything. You got nothing for me. There's nothing new you can teach me about this. I've got to tell you, there always is. So, generally, if I'm asking people about what they've done already, you and I know the research evidence and we know what's been proven to work. And pretty much always we'll find some things that someone hasn't done, particularly if I'm looking at some of the components of non-drug therapy, so like cognitive behavioural therapy, and it's got those 5 core components. There'll often be bits that haven't been explored.
Yes.
So very common for people to tell us exactly that. I've tried it all. We always find something. And then the research about cognitive behavioural therapy, which has been our standard therapy for many years, has shown that it's great therapy, but about 40% of people don't get as much of a response as they're after. And that's why in the last 10 years we've been looking at, well, what else can we do? Can we add to CBT? And that's where mindfulness comes in. And great research now supporting mindfulness as an additional therapy. If we add it on to things we've done as part of cognitive behavioural therapy and that sort of standard treatment for insomnia, it adds a lot more effect. A couple of recent trials have been published, and the work we've done together at Melbourne Sleep Disorder Centre, really shows it's a powerful addition to cognitive behavioural therapy. And one of the interesting things for me is, people also say, meditation, that ain't for me. And an interesting part of the research is if a healthy scepticism is one of the predictors of getting a better response.
Yes. Yeah.
So the sort of people...
Keep an open mind.
Keep an open mind.
Keep an open mind. Yeah.
So the people who say either meditation, I'm all over it, that's really me, or the ones who go, nah, the one who goes, no, maybe not meditation, I'm a bit sceptical, in fact, highest likelihood of getting a good response. So I find that really interesting. But that's important because bringing an open mind to it and seeing it as something that people are going to have a really good go at and being persistent seems to be the keys in making it work. And adding mindfulness to what we have been doing seems to make a really big difference in terms of improving our outcomes.
For the A to Z of sleeping well, head to the Hub, sleephub.com.au.